Hi guys, welcome back to my YouTube channel. If this is your first time seeing this beautiful face, please don't make it your last by clicking the subscribe button. And if you're a returning subscriber, hey fam, and please do give this video a big thumbs up if you end up enjoying this video. So guys, in my last video we spoke about feminine hygiene, and I listed out 5 easy steps that we can maintain stroke keep feminine hygiene. So guys, in this video we're going to be talking about infection. Want to know more about infection? Please guys, don't go anywhere. Still guys, today we're discussing infection, and I'm gonna be talking about 2 types of infection. I know a lot of people don't like talking about this topic because they feel like, oh, it's very sensitive. Oh, by the way, new hair. Yeah, I look good, I look beautiful. I know. Okay guys, so I'm gonna be talking about 2 types of infection, and I'm gonna be letting you guys or enlighten you guys on infection, what to do, and their symptoms. So guys, the first we're gonna be talking about is yeast infection. Firstly, what is infection? Infection is the process of infecting, or the state of being infected, as stated by Google. Yeah, so guys, I know a lot of people get scared when they hear infection. They be like, oh my god, is it really bad? Am I going to die? Infection is not a death sentence, okay? It's something that can be treated. We ladies are very open, and we are very prone to these infections. Be mindful and be very careful as well. So guys, like I said, I'm going to be talking about 2 types of infection. We're not really going into the we're not going to talk about like the STDs, HIV and AIDS, guys. We're just going to talk about common infection in women. Infection can be controlled. So yeast infection, we always have yeast in our body, and vaginal yeast infection is caused by a specific yeast in our body called Candida. What is Candida, guys? Okay, so when this yeast is balanced to the ecosystem of your body, there are no problems. But when that balance is disrupted, that yeast rapidly grows, then you can get an infection. Vaginal yeast infection are common, and they can also be called vaginal candidiasis or vulvovaginal candidiasis, guys. So guys, I'm going to briefly explain what Candida is, which causes yeast infection. We normally have fungus in our body. Like, it normally lives in several places of our body, like our mouth, our digestive system, and our vagina. Throughout our lives, we might or we must have experienced infection, okay, and this infection makes us very uncomfortable. The common symptoms are redness, itching, thick white discharge, swelling around the vagina and the vulva. These infections are caused by something that already exists in our body, okay. Yeast is a type of fungus, and Candida is a specific type of yeast, okay. Normally Candida doesn't cause a problem. It is supposed to be in your body. There are several conditions you can develop when Candida goes out of balance. For example, if you develop lots of fungus in your mouth, it is called thrush, and if it develops in your vagina, it is called yeast infection. So having explained that, I'm going to explain why yeast infection happens. Antibiotics. When you take an antibiotics medication that is treating an infection of any type, for example UTI, urinary tract infection, while treating this infection, that's UTI, which I'm using as an example, while treating this infection, good bacteria in the vagina is killed, and this good bacteria in the vagina is responsible for keeping the yeast in check. Without it, the balance is thrown, okay. So it's very good that you visit your physician or your healthcare provider to know what kind of infection you have, so you can be treating the right infection, so you don't go destroying the soldiers in your body that are meant to be fighting your wars, your battles. Guys, okay, so it is always good to go for tests to know what infection or what is wrong with you in general before you start taking any form of medication. Point number 2 will be during pregnancy and while using hormonal contraceptives, which is birth control, your hormones can be all over the charts during pregnancy. This change in your hormones can disrupt the balance of candida in the vagina. Point number 3 will be diabetes. When you have diabetes, there's so much sugar in your urine, and the vagina is impacted by this surplus of sugar. And the last point will be HIV and AIDS. If you have HIV and AIDS, your immune system tends to be weak due to the medications you're having. Okay, so weak immune system, guys, that's that. So moving on, guys, I'll be listing some symptoms of yeast infection, and one will be itching in the vagina or the vulva. If you have yeast infection, you tend to have itches down there, and you know, really, that area is always wet, and we are so open to these kind of things. So guys, if you notice some form of itching around that area, guys, it could be as a result of yeast infection, and you need to see a doctor. 2 would be thick white discharge. Like I said, that area is always wet. There is a discharge that comes out that is abnormal. So once you notice something like that, guys, you need to see your healthcare provider. The thick discharge, the normal discharge the vagina produces is always very light and it's clean, like it's so white. Yeah, but this one, yeast infection, it's usually always thick. Yes guys, so that's that for number 2. And the number 3 would be redness and swelling of the vagina on the vulva, guys. Moving on, 4 will be tiny cuts or cracks in the vulva due to the friable skin in that area, guys. So when you have that area guys, there's a skin there. So when you have a crack or a cut around that area, this could be as a result of yeast infection, guys. So burning feeling when you want to urinate, when you want to pee, you always have this very hurtful feeling. It hurts you. Sometimes you're even unable to pee, like it hurts so badly. That could be as a result of yeast infection. So moving on, in some cases, when you're having sex with your partner, you tend to feel some form of pain during sex. Could also be as a result of yeast infection. You need to see your healthcare provider, guys. So that's for the symptoms. Moving on, how is vaginal yeast infection diagnosed? You have to visit your healthcare provider or your physician. You need to go for tests. I don't believe in self-care medication, guys. It's not good. I'm against it, guys. So because you don't know what's going on in your system and you can't see your system, so why even treat yourself? Like that's why they're there. That's why we have doctors. Go to the hospital, run tests. You know, there are a series of tests you need to undergo to be sure which of the infections. They're going to prescribe the right medications for you to take when you discover the infection that you have. Okay, I want this video to be as short as possible, guys, so I'm just going to briefly explain every point. Treat vaginal yeast infection. When thinking about this, you have to understand that there are different types of yeast infection, guys. There are different types of yeast infection. That is why you need to get diagnosed to know which of the infection or which of the yeast infection is actually going on in your system, so you know the right medications to take for this infection. So I'm just going to point out a few and we move on to the next. It will be topical and oral. That is why you need to visit your physician or your healthcare provider so they can explain these things to you. They will let you know the steps you need to take. How to prevent vaginal yeast infection. One will be no dodging, because dodging can affect the bacteria that controls the fungus. Yes, so one will be no dodging, and no using of water-based sexual lubricants. We all know what lubricants are for. So I mean, there's the sexual, there's sex there, and then there's lubricants, guys. No using of water-based sexual lubricants. Yeah, so that's that for 2. And 3, changing out of wear clothes, especially suits. It's really not good to wear things that are wet. In my last video, I made mention of taking care of your undies. So guys, it's really not nice that you just soaked, or you just washed your undies and you dried them and they're not well dried, or they're not properly dried, and then you just take them off and then you're wearing them. Is wrong, guys. So that will be that. And the last but not the least, avoid using scented tampons or pads, guys. Pads that have deodorants, guys, avoid them. Avoid using anything that has to do with deodorants or tampons that has deodorants in them. It's really bad. Like I said, it could affect the bacteria that controls the fungus. So guys, you might want to take these precautions. It's good that you know all these things when it comes to yeast infection. So guys, that's that for yeast infection. Yes, so I'm hoping that you are taking these few notes seriously. So moving on, I'm going to be talking about bacteria infection, which is often called BV for short, bacteria vaginosis. Yes guys, so I'm just going to throw more light to this, and that's that. BV doesn't usually cause other health problems, but it can cause other issues, especially when you're trying to get pregnant or you are pregnant. BV doesn't cause other health issues at all, but it could prevent you from getting pregnant, or if you're pregnant, it could cause you some form of issues, guys. So I'm going to further explain briefly on that. So I'm just going to go straight up to the symptoms. Burning feeling when you want to pee. Mind you, BV is different from yeast infection, but they kind of like have similar symptoms, not really similar symptoms. I'm just going to explain how different they are. BV, like I said, in yeast infection, burning feeling when you want to pee, BV has the same symptom. So burning feeling when you want to pee, it gets so hard when you want to pee, it hurts, you know. And then fishy, secondly will be fishy smell that gets very strong after sex. Yeah, a lot of people, I've heard a lot of people complaining about, oh, their girlfriends, they have this fishy smell. It means you have BV. You have BV infection, guys. You can get so uncomfortable because you perceive it within yourself. It's not something to be ashamed of. It means you need help. You really need to find out what the problem is and how to treat or how to go about these things. You don't have to shy away from it. This has to do with your health. So if your boyfriend really loves you, you guys should really find a solution to it. I mean, both of you are enjoying this thing, so you guys should really find a solution to it, guys. See your healthcare provider if you are experiencing such. If you have such experience, you need to visit your healthcare provider. Okay, so number 3 would be abnormal discharge. Sometimes it could be thin, gray, white, you know, it's just really abnormal. There's nothing normal about the discharge, it's just abnormal. You need to see your healthcare provider, guys. So if you have, or if you're seeing this kind of discharge, it means you have BV and you really need a solution to it as soon as possible, guys. So that's that. BV is quite different from yeast infection. Yeast infection, the discharge doesn't smell, but for BV it smells like very awful smell, bad smell, bad smell. So for BV the discharge always smells, but for yeast, no, it doesn't smell. So that's the difference. Okay, guys, so when to see a doctor, very important to see a doctor, because BV is unlike yeast infection, and if you're having symptoms like a new discharge along with a fever and a smell, you need to see your doctor as soon as possible, guys. And two, it would be if you have more than one sexual partner, you need to see your doctor just in case of sexually transmitted diseases. There are a lot of people who have more than one partner and don't even protect themselves, which is really bad. You're prone to these things. And always advisable to protect yourself when you want to have sex, except if you're married, of course. But if you are not, it is always advisable to, you know, always protect yourself, because this has to do with your health, and health is wealth. Okay, so if you have more than one sexual partner, you need to go for will be risk factors. Any woman can get BV, guys. Any woman can get BV, but you are at higher risk if you, I'm just going to list at least three. One, if you have more than one sexual partner. Two, if you smoke. And three, if you douche. If you have more than one sexual partner, like I said earlier, you are very, very prone to having these infections, and you might want to check yourself, go for tests, and be careful. Yeah, so that's that. And then smoking, we all know what smoking means. We all know what smoking does to the body, so you're at high risk if you are if you're a smoker. Douching upsets the natural balance of bacteria, so you need to avoid scented soaps that have some form of scents, chemicals, lots of chemicals. That's why it's advisable you just use water to wash your vagina, or very mild soaps to wash your vagina. Avoid using vaginal deodorants. Like, it's really, really bad to use vaginal deodorants. It's down there, guys. And bubble baths, it's not advisable. So douching is really out of. Having a new sex partner or more than one sex partner means you are more likely to having BV, especially when it is unprotected, guys. So you have to be very careful about these things, because this has to do with your health, of course. So I read something earlier, and I'm not sure, but it says women who have female sexual partners are likely to have BV, especially when it's oral. Yeah, so let's not judge, guys. So you have to be careful about these things. You can't get BV from swimming pools or using the toilet. Moving on will be complications of BV, guys. BV has been tied to lots of other health issues, for example, premature or low birth weight. I already spoke about this. If you have BV and you're not treating it, you're not checking it, chances of taking in, or your chances of when you're pregnant are very, very low, and that is lots of danger, guys. It could be sexually transmitted diseases like gonorrhea, HIV, amongst others. Less success fertility treatments like IVF, inflammatory disease, PID. Will be preventions. Preventions, I'm just going to list a few, and I'm going to start with one. Cleaning your sex toys after use, if you are that type who uses sex toys. Yeah, so after use, you have to make sure you clean your sex toys. I saw something on social media some time ago where someone said they borrowed their sex toy and they never returned it. I don't know why you have to be borrowing your sex toy to another person. Like, get it? I really don't get it, but it is really wrong and unhealthy to borrow someone your sex toy. I mean, it's for your personal use, so why borrow it out? I see no reason why you should borrow your sex toy, because you don't even know this person, you don't know what they're carrying in their body, you know. So you really need to be careful about this stuff. Things like this are very, very vital. Granted, so if you're the type who borrows another person your sex toy, please stop that today. Stop that today, for your health's sake, guys. For your personal use, once you're done using your sex toy, it is advisable that you clean them. We don't douche. I already explained what douching means. Using vaginal deodorants, scented soaps, and bubble baths. Don't. It is against the law of your vagina. Yes, so don't douche. Get tested for sexually transmitted diseases, and make sure that your partner or your partners get tested as well, and take precautions, take measures, take steps, find solutions, take your medications, and know what you're treating. Limiting the number of your sex partners. Yeah, I know a lot of people will be like, this is the one they don't want to hear, but it is true. It is for our own good, for your own good. Yeah, limit the number of your sexual partners, guys. It is very, very advisable and very important that you reduce the number of your sexual partners, and always protect yourself no matter what. Always protect yourself. Life would be use only water or mild soaps to wash your genitals. I already explained that earlier. And 6, if you have a male partner, make sure you're putting a condom on their penis before they get into you, guys. I said we're going to be raw about this thing. We are not going to act like we don't. I'm going to say things as they are. Yes, so if you have a male partner, make sure you're protecting yourself and they're protecting themselves too. And if you have a female partner, you need to find a way around these things, because you're at risk of getting BVS, guys. I'm really hoping that this video was helpful, and I'm really hoping that you get to know the difference between yeast and BV infection, guys, and that you take your health seriously and you check yourself. Don't do self-medication, guys. I'm really hoping that this video was helpful, and if it was, please give it a big thumbs up and don't forget to subscribe. Thank you for watching, guys. That will be that. I'll see you in my next video. Bye.